Good afternoon, Petersburg Medical Center. Phil Hofstetter here. It's been a few weeks since I provided an update, and I'd just like to share a few items and take a few moments of your time. First thing is, it is September 11th, so please, if you can, take a moment of silence and remembrance on this day in 2001. A few updates on Petersburg Medical Center. Earlier this week at the assembly meeting, the borough passed a $605,000 request on behalf of PMC for CARES Act funding. This was presented as a placeholder, last-ditch effort, so we certainly do not want to tap into that. However, it is nice to have the ability to do so to help support some of the costs we're incurring related to COVID outreach, respiratory clinic, asymptomatic testing across the businesses and the community. So I want to thank the Assembly and the Borough for that. We are working very diligently on providing improved access to care during COVID time. It's been an extreme challenge. We are seeing things like home health increasing quite a bit. We're also seeing a reduction in our routine appointments, and while we have some semblance of normalcy in the ER and acute care, we're still seeing a reduction in our census in the long-term care. So those are things that we're working on. However, we're spending a lot of time on the outreach, on the asymptomatic testing, on some of these things related to COVID. Our lab is constantly busy. We actually look at the numbers and statistics. The volumes of everything we're doing exceeds what we normally have done in years past. It's just that there's nowhere to bill for it and nowhere to get insurance for reimbursement on the services. It's the real one big difference on that. So we're monitoring that closely, and we're trying to make sure that we are staying on top of a strategic initiative, a business plan for a future, as we deal with COVID, and trying to improve and access care and services. I am still trying to approach funders for our next phase in a new facility, and obviously COVID presents a really interesting challenge with that, but also creates an opportunity when we're looking at what a facility may look like post-COVID. There's things like infection control, and folks that are working from home, if they want to stay at home, is that reduce our space allocation and size of the building, and what are some services that have increased? Therapy services have increased. Our home health have increased. Home-based services have increased. Telehealth technology has obviously increased. Certainly Zoom calls, I'm not saying they're better. We're all kind of wanting that in-person visit. So those are the things we're seeing and monitoring, and how does that play out in the future for healthcare is something we're evaluating. I'm also worried about you. I'm worried about burnout. I'm worried about making sure that we have someone to talk with, whether it's at work or whether it's with mental health or whether it's with your family. Make sure you have an opportunity to share. Everyone's going through quite a lot, whether you're talking about it or you're thinking about it or not. There's a lot going on in the world. There's a lot going on locally, and there's a lot going on within the facility, all interrelated. So take an opportunity to reflect. Also, look at your wellness. I mentioned that in a blog post earlier. I can't tell you what a kayak trip did for me. It's something I know that I have to physically challenge myself or get out and connect with the country in some way, and I was able to have the opportunity to do that, and it was very successful. And as far as my mental health and my well-being, and I encourage others to look at what makes them feel healthy and well, and to really reach out and try to do those things and accomplish those. Speaking of wellness, Kelsey, Julie, Kelly have been working on a wellness program. There is a rainforest run next weekend, and it's half marathon, but there's also other distances that you can go for. I encourage you to go out, do those. It could be virtually, or it's going to be some separation, but in person for that event, and it's going to be fun. So go out and take advantage of those events that our team is putting together. Other than that, have a pleasant weekend. It's beautiful out. Take advantage if you can, and to get out and enjoy our beautiful country and our beautiful community. Thank you.